Hi, I'm Kati Dunham. I'm one of the breast oncology surgeons at Compass Oncology, and today I'm going to talk about the future of surgical treatment, and maybe we might be able to eliminate my job once and for all. So historically, breast cancer surgery was treated with a pretty intense and invasive what we call a mastectomy. And this was a surgical treatment that was founded by William Halsted. He was a historical surgeon that started at Johns Hopkins, and this was in 1900. This particular surgery carried on through 1970s. And at that point in time, a whole bunch of really smart people from around the globe decided maybe this is a little bit too much. And so they looked at different options and different opportunities for seeing if there's less, if we can do less and still have the same outcomes as far as survival and as far as the amount of time that people can go living without breast cancer. So all of these really smart scientists and doctors from around the whole world got together, and they looked to see if we could take out less lymph nodes from under the arm, or if we could take out less breast tissue, and if people would do as well. And they proved that they can. And this started in the 1970s, and very quickly over time, our science and our data and our research was moving so fast that it couldn't even keep up with the amount of time that we needed in order to see if it was effective and if it was safe and if people did as well. But today we do know that if we just take out a little bit of the tissue around the tumor and are able to get what we call clean margins, meaning that there's no tumor that is touching the edges of what we take out, then people can do as well. So women, instead of having to go and have a huge deforming surgery, can have a smaller surgery, and they have great cosmetic outcomes, and most importantly, they have very good outcomes as far as their survival and as far as the amount of time that they can go without having a recurrence. Within all of this development, we have at the same time had different parts of the body that we look at. Are there ways that we can treat tumors without actually having to cut them out? And the reason that we've developed some of these treatments is because there are very important structures in our body that we can't cut out. And instead of leaving these people with having a tumor that's growing around a major vessel or someplace near an area that's important that can't be cut out, we find different ways to try and kill those cells. And some of the different treatments that we've looked at have been microwave therapy or ethanol therapy, literally shooting alcohol into a tumor. So what we're going to talk about today is something called cryotherapy, where we go in and we freeze tumor cells. And this has been used in multiple areas of the body, one of them being the liver. And as you can possibly understand, there are very important structures through the liver, and sometimes some of them can't be taken out. So this is how this originally started. And so what it involves is taking a probe that's a little bit bigger than an IV needle that you might put into your vein in your arm. And this goes in to the middle of the tumor. And as you press a button, liquid nitrogen comes out, and it starts freezing the area, freezing the cells. And as you go around, it freezes more and more. And you can tell exactly how much is frozen. And this is found to become both successful as far as treatment and also safe for the patient. So over time, this has progressed to treatment in breast tumors. We do use it currently in the United States to treat benign tumors, usually something called fibroadenomas. And these are small growths that we know are benign that people who can't go under surgery or don't want to go under surgery can have that area frozen. And it dies off and is cleared by the body without having to have an incision at all. And as you can see, there's basically a little form of ice that comes in there. And once that all the area freezes down, you've got dead cells that the body clears out. What is phenomenal about this particular procedure is that in the lab, we found that people who have tissue that is either frozen or from some other method killed and then removed by the natural immune system of the body, is that the body recognizes these cells after they're dead and has the potential of actually going around and killing other cancer cells throughout the body that might be in other places outside of the breast. So in the laboratory, we have this information that is pretty important and pretty amazing. There's a large study that has been undertaken throughout the entire United States at a number of large cancer centers that have looked at the safety of using this cryotherapy in small, early breast tumors. They looked at women that had small tumors that were not involving the lymph nodes that were 2 centimeters or less. And they found that using this treatment, they were able to kill off all of the tumor in 75% of those patients. Furthermore, they looked at a smaller group of data, a smaller group of women, and of the women that had 1 centimeter tumors or less, 94% of those tumors were completely killed. So it appears that this can be a very effective method. We obviously have not looked at long-term data to see the safety and the recurrence, but we do know that that information is there. And furthermore, having that information that we know that our immune system develops a response, there is a study that is undergoing right now in New York at Memorial Sloan Kettering Medical Center that looks at the combination of this cryotherapy with immune therapy, meaning that we're able to get our bodies to react to these cancer cells and possibly developing our own internal vaccine, for lack of a better term, to kill off cancer cells throughout our body and hopefully make it so that we, for the long term, can prevent having a recurrence of breast cancer in our bodies. So this is pretty remarkable information. We're very early in the stages. This is not being used currently to treat breast cancer, but it is something that is being studied, and so far the data is pretty exciting. So is this the future of breast cancer surgery? It might be, and we're very excited to find out what we see in the long-term data from these studies, and we're happy and excited to be part of all of this information. And if you want to know any more information about cryotherapy or any other future advances in breast surgery, then please contact us at compassoncology.com. Thank you.